morning and welcome back. We're having our first conversation for this morning, and it's all about the celebration of World Health Day. We are joined by Kathleen Azueta, and she is the technical advisor with HECOPAB. And with her is Dr. Karen Bell, and she is no stranger to the morning show. I feel like we had you here last week.
Yes.
We did. And she's here representing PAHO and the WHO. And with her is also Diane Wade, and she is the Head Project Development Officer with the 5 Cs.
Good morning, ladies.
Good morning, and welcome.
Thank you.
So we're celebrating World Health Day, and I love that we're here again with you, Doctor, because this seems like a conversation that we will be having for a while. Let's talk about why it's, first of all, important for us to celebrate World Health Day.
Well, World Health Day is really an initiative of the World Health Organization. And interestingly, it started at the inception of the WHO in 1948. And it really is about building awareness, increasing public awareness about the importance of health. Health to life, health to development. And World Health Day specifically became entrenched in 1950. So we have been celebrating it every year for 74 years.
Wow.
Each year a theme is selected to really focus on what is relevant and critical at that time to health. And so this year's theme is My Health, My Right. And it really is about building awareness about the importance of health for everyone. And that health is a fundamental human right. You know, there are so many things that are happening now that is impacting health. And it's not just diseases and disasters that may be causing lives, but it's the climate, it's the environment. You know, all the burning of fossil fuels and the carbon emissions, indoor and outdoor pollution is claiming 1 life every 5 seconds.
Right.
Violence in communities is claiming lives, causing disabilities, but more importantly, it's also impacting our mental health. Climate change, global warming, other factors is also impacting food security, and that has an impact on our health. And so this year the theme is My Right, My Health. My Health, My Right. And so, you know, 5 C's have added something to it.
Yeah, I love that it covers all the aspects of health, not only physical health, because oftentimes when we would celebrate health, we only think of our physical bodies or the things that you put in, but now we're including mental health, which is something that oftentimes we didn't acknowledge or recognize. It was considered taboo because it's not something that you can physically see the effects on the individual until more than likely it's at its worst stage. But it's so important for us to be having that conversation as well.
Yes.
What I'm very curious about is the collaboration or implementation, if you will, of climate change, because as Sabrina rightfully says, you can't see mental health, and sometimes we don't take notice of the changes of climate that it does to your physical and your mental health as well. So let's talk about this collaborative project. Let's start with you, Ms. Wade.
Well, as Doc alluded to, in celebration of World Health Day this year, we've added on to that theme. And so we are celebrating under the theme, My Climate, My Health, My Right.
Okay.
A big part of this is that we want to start the discussions, and that environmental security or environmental health is also a fundamental human right. And that the climate change and the unfolding climate crisis is in fact serving or acting as a health risk multiplier. So the idea of food security, water security, and the subtle changes, because whenever we think climate change, we tend to jump to that space where we think about extreme events.
Yeah.
That is true.
And we tend to discuss climate change as we look at other development sector, whether it be agriculture and those. However, a big part of climate change is how it is altering our environment, and how that altered environment then impacts on those things that directly influence our well-being and our health. So there is a regional project that is funded by the European Development Fund, and it looks at the strengthening of and the resilience of the health sector, considering that this health sector continues to be eroded, and it ranges from the impact on the service delivery or infrastructure for health to the impacts that come as those secondary things, the food security and nutrition impact. We don't think a lot about the clean air and the health impact. I know if you live in Belmopan, where we are, one of the things that you will be facing of late is the burning, and what it means to the air quality, the quality of water, and of course the changes in disease transmission because of the altering of the environment.
Yeah, I was thinking about when I saw the headline, I said, what the amount of times that we've had severe flooding, the amount of times that we've had all of these different hurricanes, these different natural disasters and so on, how it affects the water. And I couldn't help thinking about people that might have access to fresh drinking water, and how all of these different catastrophes and entities affect their water supply, and how that would bring diseases, how that would bring severe rise in certain diseases that we probably didn't even think about now in 2024. And so I just wanted to ask, how now are we starting to create this awareness for persons? What is it that the three of you, or your three entities, are doing to create this type of awareness?
So we're having the walk that is scheduled tomorrow in Belmopan. It starts at 6 a.m. at the Governor General Field, and it's a walk that is bringing awareness on climate change and human health as a right. As our partners mentioned earlier, it's very important for us to start the conversation and discuss, what are some of the areas where we could bring our expertise and our different skills to bring more awareness, to educate our population. I know for the Ministry of Health and Wellness, apart from the promotional activities, we could say that, for example, the removal of the fees at the public health facilities that is aligned to the government's goal to universal health coverage, because we're eliminating, some of the financial barriers that affect access to healthcare services, and that's one of our rights, right? And we also have, for example, the rollout of the National Health Insurance Scheme to other parts of the country. We also have the smart retrofitted health facilities. We were in Corozal recently with our partners, the EU and PAHO. And these hospitals are, going to be more safe, secure, greener, and more resilient to the disasters and some of the catastrophes that we might be facing. So we are on a good track, I would say, and strengthening these partnerships and these collaborations will definitely help in bringing more awareness.
Dr. Bell, with over 70 years of reinforcing the need to prioritize health across the world, what do you identify as the main challenges that we still need to focus on?
I think certainly for Belize and many of the other Caribbean countries, although we still see some communicable diseases, and I'd just like to say here, the effects of climate change is really causing the region of the Americas to be seeing a significant increase in dengue fever now, where we have over 3.5 million cases in the region. And we have been having severe dengue, almost 3,000 hospitalizations, and about half of those have died.
Wow.
So climate change and the impact on communicable diseases is really important and significant. However, we are in the transition where we are seeing the non-communicable diseases, hypertension, high blood pressure, diabetes, cardiovascular disorders. Those are significant mental health. Those are areas that we need to focus on. And it really is a collaborative effort with all our partners, including the Ministry of Health. We have been doing capacity building and training, supporting the ministry to develop their strategic plans, national action plans. Antimicrobial resistance is also a significant health concern for us. And so, you know, it is important for the country to develop these plans for us to work together to build awareness primarily in the healthcare workers so that they in turn can impart and share the information with the general public. I think one of the important things as well is for the individuals, the public, to understand that health is a right, but it's also their responsibility. While ministries of health and governments can provide the services, and certainly I really want to commend Belize as being one of the few countries in this region, and certainly in the Caribbean, to have eliminated fees at the point of service for persons to really eliminate that barrier. And so while governments can do that, it is really the individual's responsibility to ensure that they enjoy a healthy and long life. Eat right, a healthy diet, physical activity, do their regular screenings. You know, colon cancer is one of the leading causes of death, lung cancer, cessation of smoking, you know, the responsible use of alcohol, reduction of salt, sugar. Those are the responsibilities of individuals, and I think we have a lot more to do in that regard.
I don't think that health and climate change are a new factor to talk about. I think that this has always been something that has affected us or impacted us in a way. But let's talk about some of the ways that we can see this impact. How can we have this conversation? How can we talk about it? Something that comes to mind for me is forest fires during COVID. And everybody was having this hard time breathing. You have these fires in Belmopan. It's a basin, so the air doesn't go anywhere. It just swirls and circulates in one particular area, and that affects getting better. That affects your lungs in a particular way. But what are some other ways that we can connect the two?
While you're right in saying that there are no new concepts, I think what is new is exactly that. Us having the discussion with the two in the same sentence. The whole idea of climate change and health, as I said, it ranges from the very, very subtle. Belize has made significant gains in certain diseases, malaria, and up to this point, dengue and others. And these...
Go ahead.
Very sorry. What we're facing is a setback, or a possible setback of these gains. When we think climate change and how do we approach it, and I think that is where the partnership comes in place. And what we've tried to do is to build a consortium of expert agencies that leverage or bring to the table their expertise. I can speak within the framework of the Strengthening of Health Sector Resilience Project, where we have PAHO that is leading efforts in terms of national development planning, the health sector national adaptation plan. So we're rethinking how we plan for development in the sector. And of course, the 5 Cs has a mandate to its constituent countries in terms of supporting now, after the health sector adaptation plans are in place, how do we finance it? And so the 5 Cs playing that role. The ministries of health that we are partnering in within these 14 countries are now localizing the actions for us and starting the discussions and moving away from a lot and trying to help us in localizing through demystifying and moving and making those practical linkage, because many people will not see, because they will think climate change, but exactly how does that impact as you indicated forest fires. One of the things, if you look trend-wise in Belize, we normally have extreme burns in those years where we've had natural disasters, hurricanes. Why? Because the hurricanes take down large swaths of our forested area. After a while, it dries and it adds to the burn. The idea of the directly associated with these extreme events. Normally, when you are dealing with disaster recovery, we must think about the secondary impacts. We have water on the ground, we have things, and so you have an upsurge in terms of vector-borne diseases and
how
other
it affects
things.
other industries too.
So it is a matter of tracing the lines and making the linkages between things that people speak about commonly, but they don't really step back. We are having issues of food security or insecurity, so discussions of insecurities, an increase in insecurities rather than securities. And what does this mean to nutrition and malnutrition and those other things?
You guys have your work cut out for you, really. Is there a plan to perhaps take this into the primary and secondary education sectors and see how you guys collaborate with that ministry?
Well, we do a lot of partnerships already with the Ministry of Education. So we have our health educators, our community health workers on the ground, and the education and the imparting of information and knowledge. That's also, going back to our team this year, a right to information. And so we are taking that responsibility to bring more awareness, bring that information. I can share too that from the health system approach, we are also making the system more accountable, free from discrimination, free from, discrimination, whether from your sex, religion, political affiliation. And then we're also looking at, our responsibility to developing policies and legislation that looks at addressing some of these issues that we have with climate change and addressing some of the improvements that we could do when it comes to the determinants of health, like water and sanitation. So it's a partnership, and we're extending it to all the sectors that we already have those existing collaborations.
I'm here thinking about our presence that we make at the Conference of the Parties annually. I believe you ladies or your representatives from your organizations would have been present last year at Dubai. And we oftentimes hear that Belize is recognized as a trailblazer when it comes to climate change and making these strategies to reduce carbon footprint. But we also hear in the same breath that Belize is a small island developing state, and what we're doing is only a minuscule percentage of what should be done. I suppose I wanted to ask you, Dr. Bell, representing the World Health Organization, how important is it that we have partnerships or collaborations between different nations to ensure that we fight the bigger cause and not just do the small numbers here as small island developing states?
Thanks for that question, and it's very important because you have heard it said so many times, we're a global village.
Yes.
And each country depends on the other. And even though, for example, Belize, their carbon footprint may be small, compared to some of the larger industrialized countries. It really takes a collaborative effort.
It does.
And certainly COP, you know, the Conference of the Parties, it really is starting the dialogue or continuing the dialogue and getting some commitments, because it's important to have commitments, especially from some of the larger industrialized countries that really are adding more to the carbon footprint. And so what are some of the commitments that they have made? How can we collectively have that impact globally? I remember at one of the COPs, I think it was from Tuvalu, I think, the Prime Minister, he gave his speech from in the water.
Wow.
Just to show how the rising sea levels is eroding certain islands in terms of the coastline, how it's affecting the coral reefs, how it's affecting fishing, etc. And so it really is important to start that conversation, but it does require a collaborative effort. And this is where entities like the United Nations, the World Health Organization, the Pan American Health Organization comes in as a convener, as an advocate for some of these issues, and the issues especially that affect the most vulnerable of us. It is important to raise the awareness, you know, build that public knowledge, and so demand certain commitments of others.
Yeah.
My climate, my health, my right. Since we're changing it to that now. Let's talk about the term right. We said it is your right, but it's also your responsibility. This morning we were having a conversation about the pig transplant into the human, the pig kidney transplant into the human, and how he's now functioning, etc., right? Sabrina brought up a point about the rights of animals and the rights of humans, and where do these ethic barriers meet in some way, shape, or form. How do you balance the rights of health for humanity and the ethics in between?
Well, that is something that is very important to us in health. And the World Health Organization and the Pan American Health Organization has a whole department that looks at ethics. Ethics in research, ethics in provision of health services. And there are also animal rights activists, and there are groups that also look at that. And so it really is a balance. Oftentimes we think that humans, as the higher animal, may have more rights, and so we have to look at the bigger picture in terms of development, in terms of advances in health, and how we can help to impact that. And so this is nothing new, and there are groups, any research that is done, there are ethics committees that looks at it, looks at the rights of the individual, looks at the rights of animals that may be used in science, in research as well, and to make sure that the animals are not harmed unnecessarily or do not suffer in any undue way. And so it really is a balancing act. In life, everything we do is a balancing act, you know, and so we just have to pay attention to it, be aware of it, and make as much efforts as we can to acknowledge it and to work with it.
Let's talk about the other collaborative partners as we celebrate World Health Day. We have here with us HECOPAB, the 5 Cs, WHO, and PAHO. Are there any other organizations or entities?
We have the Belmopan City Council. So they are very supportive of these initiatives as it relates to health, as it relates to climate change. They have a health focus as well, and different, they have, I guess, these collaborations with different sectors in education, agriculture, health. And so they're supporting us. We have the Western Regional Hospital. We have the staff from there who are also on standby with their paramedics. So it's really bringing everybody, from those persons who work on the ground to our technical staff, to our directors who are there championing it from that policy level. So it's really something that, like I said, it's nothing new. We have these partnerships already established, so now it's just to strengthen them, bring more awareness, and start engaging other partners, and with that we'll have more people seeing that, and deciding to be a part of this. And the walk is a good example because we're tying in several areas from tackling the non-communicable diseases, as Dr. Bell mentioned. The Easter break just went by. We are, maybe we ate a little bit too much, and so now it's time to get moving, exercise, and so that awareness is always there. It's timely to bring all these topics onto the table and to highlight them in this walk.
How as this is something I've been listening to you all talk about, all of these important factors that affect humans in everyday life. In everyday life, I'm not thinking about my health. I'm not thinking about climate change. I'm not thinking about other parts of the world that are experiencing these things. So how do I keep that at least in the back of my mind? How do I take all of these information and not maybe have like a mental breakdown as I'm going through work, trying to figure out how to be a good human being, how to balance my health, how to think about climate change, how to think about other people in the world that are experiencing the same things as I am. How do we do that collectively as individuals?
So having a clean environment, being aware of the plastics and bringing our water bottles. I've seen a lot of people now carrying the water bottles, and that's one way of being more greener, going that direction, and allowing for cleaner spaces. We have our staff who are on the ground doing cleanup campaigns, because of the dengue outbreaks in some parts of the country that are heavy right now. So those are steps that we can take to be kinder, to be more human, and it's not only benefiting the individuals, but it's a community effort.
Yeah. And I think it's important that each of us starts with ourselves.
Yeah.
And if you really love yourself, you want the best for yourself. And so what is it that will make me healthy? Drinking more water, doing exercise, having, taking care of your mental health, self-care. And each one can teach one. And that is how we will eventually share the message. So it really just starts with us as individuals. We're really selfish human beings. We want the best for ourselves. So start with that.
The selfish part of it too is sometimes we know what we deserve, but we still don't give ourselves that too.
That's true.
That's the part where I struggle to understand. But ladies, I have to say thank you as always for stopping by. I'll ask if you have any last words.
Just to invite people out to the walk tomorrow. The walk starts technically at 6. However, there's a short opening ceremony, and then the Belmopan City Council is aiding with warm-up. And then so
where is the starting line?
We're starting from the Governor General field.
And how long will the walk be?
It's one lap around the ring road, so it's about 2.5 miles.
Okay.
And we'll have music along the way.
That always helps.
DJ, music, entertainment, and just,
First 50
bring a
people
friend.
get a free T-shirt.
Oh, nice. Okay.
Okay,
Wonderful.
that's a motivator.
That's an incentive. Well, ladies, thank you so much for stopping by as always. We're celebrating World Health Day with you and with everyone else.
Thank you.
Thank you for having us.
All right, we're going to take a quick break, and when we come back, the conversation switches into the Belize Tourism Board's online portal upgrades. Stay with us. We'll be right back.